Dr. Patino here at the Cosmetic Surgery Surgery. This is micro-assisted liposuction, and this is like an electric toothbrush. You see how the tip vibrates? So we don't need to be jamming the instrument back and forth and causing bleeding like an old toothbrush. When you jam it back and forth, you can have gum bleeding. Same here. If you go very forceful, very fast, then you're gonna have bleeding, right? But I haven't even seen what's come out, but tell me.
Hey doctor, what's that coming out?
I bet it's yellow fat.
It's glowing.
Glowing, right? And
Golden.
so this is a special technique. I developed this technique in 2004, and it served my patients very well, and it served me very well. In this case, it's very important because what you see now is bloodless, oil-less aspirate. So it's pure fat. And we don't need to process this fat in any way. We don't use any commercially available cleaning systems to clean the fat of its impurities, the blood and the oil. Why? Because there is no fat and no oil. And that, as a result, our patients have a much better fat graft retention, meaning that you're gonna get to retain most of the fat that we put in, right? This is incredible. Look at that. Beautiful. So you're not gonna lose, 25 to 50% of the fat that is normally placed when you do a fat transfer to the buttocks. Normally you lose it, right? You lose 30 to 50% of the fat. So most doctors put wow. And so notice how gentle I am with the instrument. I just go back and forth. I let the electric tool do its work, right? And so I can literally just hold it with 2 fingers. And so this limits the surgeon's fatigue also, right? And also, by going slow, makes it much less likely that the surgeon perforates an organ, an internal organ, like either in the abdomen. Yeah, and much like driving a car at full speed, you can lose control of the vehicle and go to an unintended area, right, and cause significant damage, maybe even death, right? So that's how these things happen. But look at the aspirate here. It's absolutely bloodless, and of course this is an effort that involves the anesthesia team as well. If the patient's blood pressure is super high, that's not going to happen, right? The patient is going to bleed. So there's many things that go into it. It's what you tell the patient, right? I tell my patients not to take any aspirin-like medications, no ibuprofen, no herbs, no vitamins. And the surgeon himself, I don't give any aspirin, no vitamins, no blood thinners of any kind. We don't give any enoxaparin or heparin. And some surgeons routinely do all that. Some surgeons routinely give you aspirin, routinely give you herbs and vitamins and blood thinners. So yeah, of course, they're not going to be able to obtain this aspirate like that. No, absolutely no way. So there's many things that go. Also the amount of anesthesia that we use, the tumescent anesthesia, the mix, how long we wait. So it's many things, the type of cannula that we use. All that plays into it, because if you want to do many cases, then you got to be very aggressive. You got to go very fast. We just do 1 case per day, and that's it. Maybe 2 cases per day. And so we're way more meticulous, more careful, and when you do it like this, obviously less risk in complications. Look how beautiful this is, the aspirate. It's just immaculate, and that's what's going to go into her buttocks. So stay tuned. When we put this fat graft under ultrasound guidance into her buttocks, you will see this very nice, that very nice golden yellow, bloodless, oilless fat graft that we're putting into her buttocks. And so also, by not being so aggressive, the fat cells don't die, because if we go very aggressive with very aggressive cannulas at full speed, the field will be all full of blood and oil, and not only that, but you may kill the fat cells. So we also have the collecting system, which is a closed system. The fat doesn't never contact the ambient atmosphere, the air, right? So much less risk of contamination, and also when we collect it on this fat it's like the fat doesn't go into an empty pool where it hits the floor, right? It goes into a cushioned floor because we put saline so the fat cell doesn't hit the hard surfaces of the canister. Instead, it goes softly, like you diving into a pool full of water, not into a pool that there is no water. Then you may die, right? Same thing here. So there's many things that go into this. Is I can go on and on and on, but basically this is how we do it. This is how we do it here at the Cosmetic Surgery. If you would like to have a procedure like this, bloodless surgery, much less risk of bruising, bleeding, anemia, reoperation for bleeding, and nodules, painful nodules that may happen because of the octopus effect postulated by my dear friend, Dr. Guillermo Blugerman, said that there is the body of the octopus is a central hematoma, a central collection of blood. And then the tracts are the tracts of liposuction. Those are the tentacles of the octopus. Yeah, and this causes painful fibrotic bands, fibrosis, all that scarring, fibrosis, a lot of it is the result of blood. Because the blood, when it's not where it's supposed to be, when the blood is in the extravascular, outside the blood vessel space, it irritates the tissues, right? And the tissues react to it. So same thing happens in the buttocks. When you put blood in there, number one, it's not fat, so your buttock is gonna shrink. And number two, the body may react to it and you may have fibrosis, or you may have what is called a blowout fracture, where there is a deformity of the buttocks. That also has to do with the placement of the fat graft. That also has to do with the disruption of the anatomy. We don't disrupt the buttock anatomy. So there's many things that go into what we do. And of course, look at the after. This is just like completely bloodless, incredible. This is the way we do it. Thank you. Wow, so I'm ambidextrous. I'm using my non-dominant hand now. But notice how this is very important. Most surgeons are ambidextrous, but if you're not ambidextrous, you're a surgeon, I encourage you to try your non-dominant hand, because this is going to do a couple things. One, it's going to force you to go slower. When you go slower, then you're going to have this kind of output with much less blood, right? No blood at all, actually. But also, and probably more importantly, it's going to be very beneficial for the patient, because not only the patient is not going to have any anemia or bruising or bleeding or anything like that, but the patient also is going to have much less risk of intra-abdominal or intra-thoracic organ perforation. Why? Because the surgeon is going very slow, and it's very much like driving a car. If you go very fast, you can go to an unintended area, right? And cause, see, look at this, see? This is incredible. The surgeon is the same. If you drive very fast, then you can go to an unintended area, lose control of the vehicle, and crash, right? Look at this output. It's just incredible, right? And this particular patient doesn't want too much of the high definition. She already has some high definition that I did with a prior tummy tuck, and she doesn't want a lot. She wants to be more feminine without, still have a little bit of the athletic lines, but not a lot. So we're not going to do a very heavy high definition on her, just a very soft high definition, if any, or more in keeping with what she already has, which she loves, which is the high definition that we just gave her with the tummy tuck. But then again, so now I'm switching hands. This is my dominant hand, but I still go about the same speed, right? And the nice thing about this is that it's also good for the surgeon, because the surgeon is going to have much less fatigue, right? It's going to be more fresh, right? The surgeon is going to have much less risk of occupational injuries like tendinitis of the elbow, or tendinitis of the shoulder or the wrist, right? And so from doing so many cases at full speed with very big cannulas, is not only traumatic for the patient, but it's also traumatic for the surgeon, right? Same like driving a car in a very, very high speed. It takes a toll on the body, you know? Even like those car races, you know, they have very, very big neck muscles because they have, it's strenuous on the body. You wouldn't think so, but it does. So those Formula One guys, they have very big neck muscles, you know? But we're not racing here, and the only reason to race is to do many cases, is to make more money. But we're not into money here. God is my God. Jesus Christ is my God. And so I see the image of God in every patient. I pray for my patients so that they do well in surgery. I pray every day. I adore God. I go to Mass every day. And I pray the rosary in Latin twice a day. Not that, you know, I'm very pious and a saint or whatever. I'm a sinner like everybody else, but it's precisely the reason why I devote my life to God and to my patients. And so that's also very important, because if money was my God, then I'll be doing the same thing. I'll be going very, very fast. I'll be doing many, many patients. And that's stressful, actually. I become a slave of money. Yeah, not only for me, but also for the anesthesia provider, for the staff, right? Don't you feel more comfortable now, Dan? He's our anesthesia provider, doing this procedure like this.
Amen.
Yeah, amen is right. Tell us why you feel better when there is no blood loss.
You know, blood loss means there's a lot more variations in the patient's blood pressure, just hemodynamic changes in general. It means I have to make more adjustments, and it's just harder on the patient. And when there's no blood, it's smooth sailing, like, cruise control on an airplane.
Yeah, and also much less pain because of the tumescent anesthesia, right?
That is right.
So our patients then, because they have much less pain, how does that affect your anesthesia?
It means I don't have to give as much anesthetic, not as much opiates.
Narcotics, right?
Narcotics,
Okay.
Yep. So just like easier on the patient's body.
And how does that benefit the patient, not having much narcotics on board?
Oh, it's just safer for the patient in general. Less blood pressure swings, and you need less narcotics even after they wake up too. And that's just easier on the body.
What about nausea and vomiting?
Yeah, less nausea and vomiting, and less side effects in general.
Well, look at this, you guys. This is an ocean of, and we're almost done. And look at this, we're still getting an ocean of yellow, beautiful fat. And she didn't want this part, so normally we leave a little bit of fat here for the high def, but she didn't want it, so we're gonna take it out. So she's not gonna have high definition, she's gonna have a more feminine look. And she already has a little bit of high def that she likes. She's gonna keep that. Thank you. Wow, so look how comfortable I am. The patient is on her side, and look at the strokes are so calculated, so nice. We ended up giving her some high definition without even trying, because she already had the high definition from her tummy tuck that I did about over 6 months ago. And this is just incredible. And look how comfortable I am. I'm not sweating it. And we still getting this beautiful, beautiful output, right? It's just like, look at this, Wendy. Focus on this. It is just unbelievable. Bloodless, oilless fat graft. And this is precisely, pay attention, stay tuned, because I want you to see that this is precisely what's going to go into her buttocks. And it is just going to be an incredible, incredible fat graft. She doesn't want a big booty. She wants just to cover the hip dips a little bit and a little bit of an augmentation. So that's what we're gonna do. But I'm telling you, man, she doesn't want anything exaggerated. And we don't do exaggerated things. If you want something exaggerated, I can do it for you, but it would have to be on several sessions. All in once is difficult to do, because the buttock space tolerates only so much, especially if you just do it like we do, in a safe manner under ultrasound guidance, going only into the deep subcutaneous space. If you go into the muscle and under the muscle, yeah, you can give a big booty, but man, in one session, but the risk of death is astronomical. And so we don't do that, and we just go, we put the fat where God put it, and we do it under ultrasound, under direct visualization, because unfortunately, a lot of these surgeries are still being done blindly, you know. And so I am the CEO of the World Association of Gluteal Surgeons, and so we're promoting this fat graft under direct visualization with ultrasound to make it safe. Thank you. The buttocks are over here, and notice this is the waist, okay? Notice the pinch test, see? 0.5 centimeters everywhere you go, see? 0.5 centimeters, see? You can see 0.5 centimeters. So no excess fat. There's a little bit of excess skin here, but not excess fat. And look how beautiful she looks. Thank you. Wow, man, we're almost done. I think we have maybe a half an hour more, and she's on the other side. We're giving her a nice wave here. Notice how relaxed I am. Notice how the strokes remain very gentle, very soft. 2 fingers basically here on the cannula. The small cannula, atraumatic cannula, non-aggressive cannula, and look, of course, look at the output. It's just incredible. It's just incredible, you guys. To maintain this level, it's just unbelievable. No blood loss here, no anemia, no blood transfusion, no post-operative exhaustion. The patients usually have this procedure with the traditional technique, man, and wow, they cannot even barely walk, you know, because not only they're in severe pain, but also because they lost so much blood, you know. Some doctors, they give blood transfusions during surgery, your own blood or blood from other patients, right? That's taking the patient to an extreme, in my opinion, when you can save all these. That's unnecessary blood loss. All that is unnecessary. By the way, we don't use TXA or tranexamic acid. We don't use that. We don't need it. Why? We tried it, but how can you improve this? You can't improve it, right? We don't use any commercially available systems to clean the fat. Why? Because we don't need it. It's clean to begin with. Thank you. The other side, this is the waist on the other side. Buttocks are over here. And again, I'm going to show you the pinch test. So this is like about a half a centimeter. So no excess fat here. There is again a little bit of excess skin here, but no excess fat. So look at that. Incredible. Thank you. Wow, so this is her back. Look at that. These are the paravertebral muscles. She looks very well defined in the back. And the buttocks are over here. Thank you. All right, so you're gonna be the first ones to see what we're putting in here under ultrasound guidance. So this is the fat graft that's going in. It's completely bloodless, it's oilless. So what I'm gonna do is I'm looking at the ultrasound, I'm looking at the fat that's going in, and of course I'm looking at the patient. And so we're putting this fat graft that's completely bloodless, oilless, into the deep subcutaneous space according to the World Association of Gluteal Surgeons guidelines to keep this procedure safe. So we don't do this in a blind manner. We do it under ultrasound guidance so that the patient doesn't die. So far we never had anybody die. We want to keep it that way. But look at the fat graft that has not been treated in any way. This fat graft was collected on 500 ml of normal saline, 100 already. So when we got 100, we're gonna move to the other side. And what I do is I come out and I move to the other side instead of going from here. It's safer. Thank you. And so you see the fat graft again going in here into the deep subcutaneous space under ultrasound guidance. Here, according to the World Association of Gluteal Surgeons guidelines, this is just incredible. And what I do is I put 100 ml of the fat graft into each buttock, and then I move to the other buttock, right? So that everything is very symmetrical and the quality of the fat is basically also similar. You know, instead of doing one buttock and then moving to the other one, because then the quality of the fat may be different from one side to the other. This way is more symmetrical, it's better. And the fat graft that you see here is completely bloodless, oilless. The way we obtain it is the way that's going in. This was collected on a closed system. Thank you. We have 100. Now we're going to move to the other side. I want to show you on ultrasound how this looks on ultrasound. Okay? Thank you.
Okay, reporting live from OR1. We are here doing a BBL, and this is the ultrasound image we're showing you live. Up here we have the patient's skin, and then below that is the superficial gluteal fascia. After, below, we have the cannula in the deep subcutaneous space, and this is the tip of it. And then below that, he's wiggling it, Dr. Patino, is the deep subcutaneous fascia, and then the striated muscle is right below that.
Yeah, the deep gluteal fascia.
Correct.
Anyway, so here is the cannula, and then
Right
show
there.
the superficial gluteal fascia right above it. That's
Right
broken.
above it.
And then below,
And
the
then
deep gluteal fascia, and
deep
below that
gluteal
is
fascia, and that is the muscle below
striated
that, the
muscle. You don't want to
striated
go there.
muscle.
So
Correct.
now point to the tip of that cannula.
Here's the
Drawing it
tip.
a little bit. And what's going to happen now? Tell them.
So as he enters the fat in the space, this area is going to get bigger and it's going to produce gray cloud images, so we know where the fat is going.
All right, 1, 2, 3. Look at that gray cloud.
So here's the gray cloud, and it's moving the striated muscles down as the fat enters in the space, and this is the safe zone.
You can even see the fat drop coming out of the tip of the cannula. Incredible. And so I inject this as I withdraw in a retrograde manner, and here we go again.
And then it moves the muscles
So
down.
now the space is bigger because it was, how big was that when we started?
It was
Like
like 2
2 centimeters.
centimeters
That's
about.
tiny.
Very
If
small space,
you,
very
if you
small.
see that, if you do this blindly without the ultrasound, you could easily miss it, and then you go into an area you don't want to go.
Correct.
And deep down here, for example, are the completely bloodless and oilless fat graft. This is going to survive nicely. And it's a fat graft that was not processed in any way. Very natural. Buttock augmentation. She didn't want a lot. She just wanted to cover those hip dips. So we did give her about 750 ml of fat on each side. I hope she's happy. I'm happy. Thank you.